What makes tPA a miracle drug for stroke recovery? Imagine a treatment that can potentially save brain cells from irreversible damage just by dissolving a blood clot. That's what makes tissue plasminogen activator, or tPA, often called a miracle in stroke care. To understand why, let's start with what happens during an ischemic stroke. When a blood clot blocks an artery in the brain, blood flow stops, and brain cells begin to die within minutes. The faster blood flow is restored, the better the chances of recovery. That's where tPA comes into play. It's a medication designed to dissolve blood clots quickly and effectively. tPA works by activating a protein in the blood called plasminogen. When activated, plasminogen turns into plasmin, an enzyme that breaks down fibrin, the main component holding the clot together. This process, called thrombolysis, can reopen blocked blood vessels and restore blood flow to the affected part of the brain. Because tPA specifically targets fibrin in clots, it minimizes the risk of bleeding elsewhere in the body, making it a precise treatment option. The reason tPA is considered a miracle is because of its ability to significantly improve outcomes when given promptly after stroke symptoms appear. Clinical studies have shown that, if administered within 3 hours of symptom onset, and up to 4.5 hours in certain cases, it can increase the likelihood of a patient regaining independence and surviving with less disability. The earlier it is given, the more effective it tends to be, which is why rapid response is crucial in stroke treatment. However, tPA is not without risks. Because it dissolves clots, it can also cause bleeding, including bleeding in the brain, which can be serious. That's why its use is carefully regulated. Doctors evaluate each patient to determine if they are suitable candidates based on factors like how long ago symptoms started, medical history, blood pressure, and other health conditions. Certain conditions, such as recent surgery or a history of brain hemorrhage, can make tPA unsafe. In hospitals, tPA is administered through an intravenous line, usually in the emergency department, with close monitoring for signs of bleeding or other complications. Sometimes, if a large clot cannot be dissolved with tPA alone, doctors may perform a mechanical thrombectomy, a procedure where a device is used to physically remove the clot from the artery. Combining these treatments can sometimes lead to even better recovery chances. It's important to remember that while tPA has revolutionized stroke treatment and saved many lives, it is not a guaranteed cure for everyone. Outcomes depend on how quickly treatment begins, the size and location of the clot, and the patient's overall health. The term miracle drug reflects the profound impact it has had on stroke care, but it must be used with caution and under strict medical supervision. In summary, tPA is called a miracle because it can dissolve dangerous clots, restore blood flow, and potentially save brain function if given promptly and correctly. Its development marked a major breakthrough in acute stroke treatment, but it's essential to seek immediate medical attention if stroke symptoms appear. Always consult healthcare professionals for personalized advice, as every stroke case is unique and requires careful assessment to ensure safety and effectiveness.